Hello, students, and welcome back. We are in Modular 8, Healthcare, and this is the third of 3 videos for the lecture for this particular modular. And we are going to proceed spending some time taking a look at the ecological perspective in terms of healthcare. And so we're going to kind of expand outside of maybe just our neighborhood, our city, our state, our country, and really look at it from a world viewpoint. So let's look at what the World Health Organization has to say in terms of a definition for health. They define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it's important to think about health in terms of a biopsychosocial perspective, your physical health, your mental health, and your emotional health. So health, again, is not simply just the absence of disease, but it is actually taking a look at the mind-body connection and making sure that everything is working in sync, so to say. So this definition is ecological in nature because it demonstrates the relationship and dependency on a combination of environmental, physiological, sociological, and psychological factors, mind and body. US health policies develop the use of indicators to track progress met in improving the health of the country by 2020. And again, hopefully you've taken a look at the video, Healthy People 2000 Determinants of Health, that reflects that particular policy effort. Okay, so funding and costs. These are critical issues in healthcare. US is projecting to spend over 4.5 trillion on healthcare by the end of 2020. Things include hospital care, physician care, prescription drugs, nursing homes, other professional services. These are usually paid for through insurance or the individual patient. However, 48% of all healthcare related costs are using public funds, so Medicare, Medicaid, Medi-Cal. Government at all levels is trying to find ways to reduce the cost of healthcare. And as a result of this, some physicians are ending their practices due to the reduced level of reimbursement they are receiving from Medicaid or Medicare, or again, what we call Medi-Cal. So interesting to think that the cost to operate a physician's office cannot be sustained or cannot be sustained if a person is working off of only receiving payment from Medicaid or Medi-Cal. So what you will often see is that, particularly as a social worker, if you're reaching out to the physician community in the particular area that you're working in to ask about whether they accept Medi-Cal or Medicare, they will often either say no, or they will say, I allow that 20% of my practice can be Medicare or Medi-Cal, and that they're only accepting new patients that have Medicare or Medi-Cal based on that 20%. So cost versus outcome. The US spends more on healthcare than any other country, yet our healthcare systems do not produce superior outcomes in comparison to other countries. We are 26 out of 36 in terms of all other industrial countries for life expectancy. We are ranked 169 of all countries on infant mortality rates. And in 2018, the US spent 18% of the gross domestic product on healthcare. Some of the reasons that we're seeing rising healthcare costs include the rapidly growing elderly population. Between 2005 and 2050, the population over 65 is projected to increase from 36.7 million to 86.7 million in the US. This is a 67% increase. The other reason for rising healthcare costs is the fact that we have increased knowledge and technology. The rise in technology makes expensive procedures more available to everyone. Not to be insensitive, but 100 years ago, if a child was born prematurely or was born with low birth weight or health complications, more often than not, that child did not survive childbirth. But today, we are able to have a child survive childbirth under those kinds of conditions. You hear stories all the time about babies who are born extremely underweight or extremely premature, and because of all the new technology that we have and the resources that we have, we're able to save that child's life, which is amazing. The thing that's important to consider relative to what we're talking about here in terms of healthcare costs is we are often more likely than not now going to have an individual who's going to need relatively expensive healthcare for the remainder of their life as a result of their experience at childbirth. So the health consequences or health complications that they're going to experience as a result of being underweight or being born prematurely are going to be things that are going to need to be cared for throughout the entire life of the person. So again, goes back to those ethical and moral choices that people often have to make. Here's another example, heart transplant. So on average, a heart transplant is going to add about 4 years to an individual's life. The cost factors include $271,000 for the surgery, plus $21,000 annually for meds and follow-up, for a total of $62,516 per year for each of the 4 years added. So the question is that the best utilization of our funds? If you're the person who needs the heart transplant or the family member of the person who needs the heart transplant, your answer is probably yes. But if you were looking at it purely from an objective standpoint and taking a look at it purely from an economic standpoint, you might question whether that was a good investment of funds. We're seeing increased costs for healthcare for the poor. Again, the concept of Medicaid, we've talked quite a bit about that. Again, what we call Medi-Cal in California, which is a public assistance program funded by the federal and state governments that provides healthcare to low-income individuals and families based on a means test using strict eligibility guidelines. It's the single largest source of funding for health services for low-income people in the United States. Medicare is the medical care coverage program for older adults, established as one of the pillars of the War on Poverty program in the mid-1960s. Healthcare today focuses on restoring health after the illness has occurred, indicating that there's still a need for more prevention efforts. In the long run, it's always more cost-effective to be able to treat something before it becomes a disease. So taking a look at issues like heredity, if you've had family members who've experienced heart disease in the past, if you have family members maybe who have experienced diabetes, those may potentially be hereditary. So rather than waiting until you have a heart attack after you've known that your parents were both at risk for heart attacks for years and years and years, doesn't it make more sense to be on medications or making sure you're watching your weight, making sure you're exercising on a regular basis, all as preventive factors to prevent the likelihood that you'll experience the same kind of health complications from heart disease that your parents experienced? So that's the concept of prevention versus intervention, and why prevention is always preferable, because it costs less and you don't have to experience a heart attack and then start to get better. You can be working on preventing having that heart attack from the very beginning. And it's never too late to get started. The 3 leading causes of death in the United States, as reported by the CDC in 2018, were heart disease, cancer, and respiratory diseases. Environmental factors may be a significant contributor to increases in new cancer diagnoses, which means that if you live in an environment that is highly polluted, your risk for cancer may be increased. And I think you saw that in the Aaron Brockovich video that was part of this modular. There is a lack of prevention and wellness programs, but I think that's improving over time. And one of the other concerns relative to health is teen pregnancies. This is a concern as teens may be at greater risk for giving birth to infants with congenital problems. Often because teens, because of the stigma that's associated with being pregnant as a teenager, may impact your ability to be able to access prenatal care. So either you haven't disclosed to your family members that you're pregnant, you don't have a mechanism of being able to get to a doctor in order to be able to get prenatal care. All of those are contributing factors to possibly congenital problems later on. And then you have questions about saving lives at what cost. There was the baby doe cases. This law came about as a result of several widely publicized cases involving the deaths of handicapped newborns. The parents of these children withheld standard medical treatment for correctable gastrointestinal birth defects, leading to their death by preventing nutrition and hydration. So often based upon religious beliefs or moral beliefs, they felt that these children who needed medical intervention, they withheld that medical treatment or medical intervention because of their religious or moral beliefs. And as a result, their children died. And the question then comes down to who should be making those kinds of decisions? Should the state, should the doctors, should the parents? Who should be making those kinds of decisions? And is it appropriate for somebody's personal values to impact the likelihood that their child will survive or not? There's issues about right to die cases. We're going to spend some more time talking about those in an upcoming modular. Bioethics, some people wonder about whether the manipulation of human cells through genetic engineering is contrary to the laws of nature or religion. What about cloning? What about the use of stem cells? And what about alternative medicines? So herbs, acupuncture, different kinds of alternative medicines. Should those be covered by insurance? There's still a lot of controversy as to whether or not that is something that should be considered. The goals of healthcare reform are to reduce long-term growth of healthcare costs for business and government, protect families from bankruptcy or debt because of healthcare costs, guarantee choice of doctors and health plans, invest in prevention and wellness, improve patient safety and quality care, maintain coverage when you change or lose a job, and end barriers to coverage for people with pre-existing conditions. And actually several of these, ending barriers to coverage for people with pre-existing conditions, maintaining coverage when you change or lose a job, those are all elements of either HIPAA, the Health Insurance Portability Act, or the Affordable Care Act. What's the relationship between social work and healthcare? Social workers are often found in healthcare settings such as hospital, long-term care facilities, and nursing homes, community-based programs, home health care, and state departments of health or health planning agencies. They conduct screening and assessments. They provide individual counseling related to illness or death, provide case management services, and represent the hospital in the broader social work community. And that concludes Modular 8, video lecture 3 of 3. So I hope you'll now proceed and take a look at the remaining videos that are available to you in the modular. Begin to work on the discussion board, and obviously conclude with the quiz. Again, I would suggest if you have any questions or any challenges that you're running into in the class, one of the best places to start is to have a conversation with me. And that's something that we can conduct on Tuesdays at 6 o'clock when we hold office hours. Or if that's not convenient for you, please know that you can always get in contact with me and we can set up a quick Zoom meeting or communicate over email or communicate over the phone, whatever works best for you. So leaving it at that, I hope you're doing well. Please recognize that we are more than halfway through the semester. This is a good time to start looking at grades and seeing where you're at and what you need to be doing for the remaining weeks of the semester in order to make sure that you get a passing grade. Remember that you have a written assignment that comes up later in the semester in December, where you are expected to interview a social worker. And if you have not identified a social worker to interview, that's something that you need to start thinking about and moving towards. So again, feel free to email me or join us on Tuesdays. In the meantime, have a good day or good evening, and I will catch up with you next week. Bye.